Hello and welcome to the HealthICTPortal tutorial for uploading content into the virtual health community. The first thing that you'll need to know is to upload content you need to be registered as a supplier. Now in the registration screen you have the default option is to register as a user. If you wish to register as a supplier, then you have to click this link here. This asks for a bit more information in terms of the organization that you work for, and also has the ability to have an authorization contact for purchasing in terms of the billing details section. Now this is important as this user receives an email to authorize content upload, which is particularly important when content is purchased, and therefore we require the owner of the copyright to register and upload through that registration. Okay, so in the example I'm going to give you here, I'm going to register as an IHE user. And I've logged in and we'll get the supplier zone menu, and inside there you'll see a few different things from the regular user menu. So we have, first off, we have available credits. So all documents have a credit cost. We'll look at that a little bit later on. Now, whether you pay for those credits or not depends on whether you work for a commercial organization or a healthcare IT, or part of the healthcare IT provider community. So if you work for a commercial organization, you can purchase credits through the PayPal options available here, or you can contact me directly, again through queries at healthictportal.com to buy credits offline. Alternatively, if you're a non-commercial organization, then you can again email me with your queries, explain your organization context, and we will credit your account with free credits accordingly. Okay, so once you've got some credits in there, then we're going to go into Manage My Files, and in Manage My Files I've got a list of files that I've already uploaded, and then at the bottom of the screen here, let me just move this display down a little bit so you can see that. You will see a submit file logo. So I'm going to submit file to upload some content. Okay, now first of all you have to choose which kind of document it is that you're going to upload. Now in this particular case I'm going to upload a case study. If you want to submit an overview of your commercial company, if it's independent review papers, or if it's a podcast or a video case study, there are different categories for you to upload information into. Now the reason that these have different costs is related to a combination of worth and bandwidth. So for example, podcasts and video case studies take more bandwidth, therefore they've got a higher cost. So anyway, in this particular case we're going to upload a PDF, so I'm just going to navigate to my documents here and have a look in the IHE section, and I'm going to upload a success story, a success case study. So I'm going to upload that, and I have to tell it now in here which kind of document it is. So I'm going to choose a PDF case study, and I also get to determine which departments I'm going to upload this into the hospital. So where it says department here, I've got the whole map of the virtual health community laid out in front of me. Unfortunately it's not in alphabetical order, so you just have to scroll through it to find what you need. But at the top level we have the department, the root department, and underneath that we have each of the major categories, and beneath that the subcategories. So in this particular case I want to upload something into the medical imaging IHE department. Now I actually want to put that into a few other departments as well because I think it's relevant to other departments. So I'm going to scroll down through here, and then I'm going to press Control and click to add it into the pathology department. I can also go through and just add it again using the Control button, add it into outpatients, maybe into general wards, and let's throw it into maternity as well. Okay, so that's all the departments I want to upload the document into, and say remember to use the Control key, because if you click without the Control key all of your selection will be lost, apart from the last one you selected. And now I'm going to put some descriptive information in about the file. So this is a DMC success story. A practical example of using IHE to achieve interoperability. Okay, now I might choose to add in there as well. Okay. Now something else to be aware of. The document cost that's at the top of that you saw earlier on. There is a multiplier for each additional copy of that document that you put in, so that's listed here, so 20% of the initial document costs. So when we go to submit the file, we'll see a calculation that tells us what the total cost in credits is as well. Okay. Now, a little bit more information. We have a generic terms and conditions section in here, which I'll just open up in a new tab there, and which talks about terms and conditions, acceptable use policy, privacy policy, etc., etc. Now, I'm just going to close that off, but the important thing to note is that we do cover a lot of the general copyright issues in terms of we respect the IPR of the content provider. We ask that the users do not distribute the document and only print off one copy for themselves. However, if you've got specific license terms that you want to add in, you can put them in here, and if you want to force the user to agree to those terms, then you can make them click a button as well with this must agree to license checkbox. Okay, so I'm just going to put some more further information in here. So 1.0 be file version, an author IHE UK, and if I wanted to reference off to a page where that file could be found, I can put that in here. So just a couple of things there in terms of the content IPR. You must own the copyright of the document before you can upload it, and the other important thing to note is that the document cannot contain any patient identifiable data. Obviously subject, I'm sure that everyone's aware of privacy concerns these days, but I'd just like to reiterate that we don't accept documents that have got patient identifiable data in. Okay, so now I'm going to confirm that I want to upload that file by accepting the terms and conditions, submit the file, and it tells me that that document I've uploaded, which had an initial cost of 200, with all of the multipliers for the multiple copies put on, comes to a total of 360 credits, and it's for a 12-month duration. Okay. I'm going to click OK to upload that, and at the bottom here, maybe slightly just off your screen, it says sending request. So we just need to wait for a minute or so for that to come through, and now we get the message that says file uploaded pending confirmation. Okay, so what's happened now is that the file is in a repository, and it's sent an email to the authorized user that's under the billing section of the registration. And if I go through to my web client of that user and just do a check of my email, there we go, I've got a new message that says confirmation required. So a new file has been submitted from your account to authorize and publish this file. So we're going to click on this hyperlink, and let me just do that again, authorize, and you get the message your file upload has been confirmed and published. Submit the file now. Okay, so we don't want to submit another file now. We can just have a look at the file we've submitted, and it gives me the information that we've got there. And of course, the most useful thing now would be to see it in the virtual health community itself. So just scroll up a bit, and I'm going to click into the virtual health community, and I put copy imaging department and the general wards department, I think. So let's have a look in general wards for a different screen, and it would be in the standard section. And there we go, DMC success story, a practical example of using IHE to achieve interoperability. And finally, we just click to open it, and here at the bottom, the documents in my browser, and there you see, voila. Thank you.